Bismillah ar-Rahman ar-Rahim. I am Dr. Nabil Sarhan, Assistant Professor Al-Azhar University. This is a case of female Saudi patient, 22 years old, represented by unilateral discharge with bad smell. CT scan MRI done revealed unilateral fungal sinusitis. You can see video clip for this case. Now we open the maxillary sinus. This is the uncinate process. We remove the uncinate process and there is wide middle meatal anterostomy, natural widening of the ostia. This is the agar nazi cell and the removal of the remaining part of the uncinate process by sickle knife, and we try to remove the fungus from the maxillary sinus. It's very huge amount. We use the shaver to help us to remove all stuck fungi inside the maxillary sinus, causing expansion of the sinus, as you can see in this video, and compression of the septum to the other side because it's long standing and a very huge amount. All of this fungus from the maxillary was very big amount, and now we clean all of this fungus from it, and you can see the mucosa after removal of the fungus. It's not invaded, meaning allergic fungal, not invasive fungal. Then we go to open the bulla ethmoidalis and we clean all fungus from the bulla after opening, and this is the fungus from the bulla, and this is still on the bulla. And then we open the posterior ethmoids and the removal of the fungus from the posterior ethmoids, and clean and flush all of bone from the bulla and the posterior ethmoids along the skull base here, and avoid to injure the mucosa. Here is the sphenoid sinus. Opening of the sphenoid sinus, part of the superior turbinates removed, as you can see, and this is the ostia of the sinus, and we remove the secretion from inside the sinus, and then we try to widen the sinus using shaver and the flush of bone across the skull base to widen the sinus and prevent recurrence of the fungus again. And this is the flushing. Come back to the frontal sinus, removal of the fungus from the frontal sinus and supra, cleaning of the frontal sinus and supraorbital recess, widening of the frontal sinus. It was narrow frontal sinus and supraorbital cell, and this is the fungus from the frontal. It's, you can see it's very clean now, and this is the skull base, and you can see the sphenoid sinus, optic nerve, internal carotid artery in the sphenoid sinus. Thank you.